Hello, I am Hiroki Kogami. I will introduce my research. Many stroke patients have suffered from declined physical ability. Our research objectives has 2 points. We analyze intervention of physical therapist, and clarify how muscle synergy structure changes, in hemiplegic patients with physical therapist intervention. First, I will explain the first objective. In the left video, it is a little difficult for the patient to stand up on his own. But he can easily stand up with intervention in the right video. PT intervention changes standing up motion of patients. What kind of intervention do they perform? We measured and analyzed EMG from upper limbs of PT, to clarify how and when they intervenes patients. This graph is muscle activity of PT's arm, that intervenes distal thigh. This shows that PT pulls the thigh before buttocks leave, and extends the knee at hip rise. This graph is muscle activity of PT's arm, that intervenes posterior pelvis. This shows that PT supports the posterior pelvis. This is the summary of PT intervention. The PT first pulls the distal thigh before buttocks leave, the PT second extends the knee and supports pelvis. Next, I will explain about the second objective. This study employs the idea of muscle synergy. Muscle activities are represented by the linear summation of spatiotemporal patterns. Our previous research suggests that 4 synergies exist in human standing up motion. Furthermore, 4 synergies activate sequentially. We analyzed EMG from lower limbs of hemiplegic patients, for muscle synergy. We divided 12 patients into 2 groups based on muscle synergy. In Group 1, muscle synergy 2 was activated later than that of the healthy elderly. In Group 2, the activation duration of synergy 2 was longer than that of the healthy elderly. But, when the PT intervenes patient A who has delayed synergy 2, synergy 2 activates earlier. Furthermore, when the PT intervenes patient B who has longer synergy 2, synergy 2 activates shorter. This is conclusions. We analyzed PT intervention, and found PT intervenes the patient before and at the time of buttocks leave. PT intervention improved muscle synergy structure. PT changed activation timing earlier, and shortened activation duration properly. Thank you for listening.